Welcome to another segment of Health Matters. Extended interviews with physicians, dietitians, and specialists from the University Medical Center. We use portions of these interviews on WVUA 23 News, and a podcast and web extra video of the entire interview is available to you online.
For today's edition of Health Matters, I'm sitting down with Dr. Antonio Gardner, who is the Director of Education and Evaluation for Rural Programs. Thank you so much for being here with me today, Dr. Gardner. My first question for you is just to tell me about the rural programs that you oversee and what makes them unique.
Yeah, so we developed the rural programs back in 1993 as an initiative to address the physician healthcare shortage in the state of Alabama. So literature would suggest that the state of Alabama needs about 223 physicians to be in a position to actually be adequately serving its residents. And so as a solution to that problem, the rural programs were developed. Our initial programs focused on physicians, and we have expanded since to dentists as well. And so since 1993, we've developed 7 programs from high school all the way up to medical school and now dental school to address that shortage in healthcare providers in the state of Alabama.
Yeah, so you mentioned you start with high school students. Why do you think it's important to start that early with that age demographic?
Yes, the earlier you start, the more exposure you provide for the students. The educational opportunities come along as well. For the students who are enrolled in our programs, we make sure that they receive dual enrollment credit through those programs. So they come to the University of Alabama for 5 weeks each summer. One program is for high school juniors, and it's open to all healthcare professions in general. So if you want to be a nurse, a dentist, psychiatrist, you're not really sure just yet, this is the opportunity for you to get your feet wet and be exposed to the STEM curriculum. So they typically take the chemistry course as well as the creative writing course here at the university, and we expose them to field trips, seminars, actual practitioners in the field as well, and take them on some fun trips, maybe to Six Flags, things like that. And the program for the high school seniors is more specific. And it's more focused on the rural students who are from more underrepresented backgrounds in medicine. We're starting to focus more on narrowing that focus from healthcare broadly to medicine more specifically. And so it's that transitional period as well from I'm finishing my senior in high school, but I'm also about to be a freshman somewhere in the state of Alabama or elsewhere in college. And so they only take one course in biology. And the same thing with that program, they enroll in courses here on campus, take the field trips, get exposed to healthcare providers, and take a fun field trip as well at the end of the program. And then there's a dental component as well for high school juniors, which we have about 3 to 5 students per year who also are in that high school group. 3 to 5 years. This is all, not it.
That's incredible. And tell me a little bit about what specifically a part of these programs is preparing them for a career in rural healthcare.
Yeah, so with our programs, we ensure that they are enrolled in that STEM curriculum. They're getting the shadowing experiences where appropriate. They're getting exposure to hands-on skills such as doing blood pressures or learning how to do a CPR and get certified in CPR. And so we want to make sure they have that skill set as well as the scientific foundation for the programs to ensure that this is something they truly want to commit to for the next 4 to potentially 12 years of their lives, depending on what their outlet is from the programs.
Yeah, and for any parents, teachers, community members watching, what can they do to be a part of the solution when it comes to increasing access to rural healthcare and supporting these programs?
Yes, please send your students our way. So stay connected with us on Facebook, on Instagram, follow our website as well. We will be advertising for the next cycle of programs starting in October. So especially those undergraduate students with the Tuscaloosa Rural Premedical internship, we'll start to open applications for that very soon. And we want to make sure that all of the rural students especially have at least the opportunity to participate in our programs and be exposed to what it could potentially be like to be a rural physician or a rural dentist, or even if you want to be a rural chiropractor or a rural pharmacist, what does that look like from the lens of our programs, and connect with those potential colleagues down the road, because a lot of times what happens is the individuals in the programs end up connecting, maybe a cohort ahead of you or a cohort behind you, and those end up being their colleagues in practice down the road. And so our programs, again, have been around 32 years now for the high school programs, and 30 years is what we're celebrating this year for the Rural Medical Scholars, which is our outlet for students who are interested specifically in medicine. They're guaranteed slots in medical school at UAB, Hearsink School of Medicine, for their enrollment in medical school. Yeah. And the outlet, ultimately, what we want to see is those students come back to rural Alabama, practice in rural Alabama, in what we call primary care. And so primary care for us is family medicine, internal medicine, and pediatrics. Those are the greatest needs, and usually the first contact before you're even connected to a specialist. So we need those primary care providers first for rural programs and for rural Alabama to make sure that our health outcomes down the road are the absolute best.
Can you give me the names of all of the programs?
Yeah, so again, we have 7 programs from high school all the way up to medical school and now dental school. The first program is for high school juniors. It's called the Rural Health Scholars Program. The next program is called the Medical Opportunities and Outreach in Rural Education, affectionately known as MORE Scholars, program for high school seniors. We also have the Rural Dental Health Scholars Program, which is for high school juniors. Next is the Tuscaloosa Rural Premedical Internship Program, specifically for undergraduate students who have completed at least their sophomore year of undergrad. Then we have the Rural Medical Scholars Program, which guarantees students admission into the Hearsink School of Medicine at UAB. And then we have the Rural Dental Scholars Program, which guarantees students admission into the UAB Dental School. And then finally, we have the Rural Community Health Scholars Program, which is designed for students who may need to address MCAT score, interviewing skills, or some other attribute that may be affecting their admission into medical or dental school.
Yeah, well, it sounds like some really incredible work that you're doing with these programs. Thank you so much for being here with me today. I really appreciate it.
Thank you.
And now, here to speak further about rural healthcare, we have Candace Lacey. Candace is the program coordinator for the Tuscaloosa Rural Premedical Internship Program. Thank you so much for being here, Candace.
Thank you, Ashley, for being here as well.
My first question for you is just to tell me about the Premedical Internship Program. What makes it unique?
Absolutely. So the Tuscaloosa Rural Premedical Internship is a 7-week program where we invite students from across the state of Alabama. Of course, the main criteria for them being rural and having completed at least 2 semesters post-high school. There are other requirements as far as GPA, test scores, things of that nature. But we invite them to campus to kind of immerse them into what it takes to really be a healthcare provider in rural Alabama. We expose them to shadowing opportunities with our physicians here at UMC, as well as in our rural surrounding communities. So they get an extensive amount of time in the clinics to get hands-on experience and to just look at the day-to-day operations and what it is in terms of rural living and providing that health care there. We also have special workshops for them throughout the summer where they get hands-on experience with suturing, blood pressure monitoring. And we try to educate them on some of the real issues that you see in the rural communities that you wouldn't normally think about. And then we do also take field trips into those communities so that they can further see what it is and how rural life is outside of where maybe they lived, because each community is definitely unique. It's not a one-size-fits-all thing. So we like to get them out and expose them to rural industries. So if they're practicing in a town that has a specific industry, they would know what kind of injuries they may see. So we just try to think of big picture things of what you may not necessarily think of every day, and make sure that that is something that they would definitely like to go into.
Yeah, so you're working to provide these students with specifically hands-on experience. Can you give a good example of that, what that looks like and what kind of impact it's making?
Absolutely. So this past summer, like I said, we offered those different workshops, and we have some of our professors and staff from UMC to come in, and they actually learn how to suture. So it's a little unique in that we use a pig's feet, and they are actually able to get their hands dirty with learning the techniques of tying the knots and how to absolutely, make the suture better suited for healing and to prevent infections. So things of that nature. We also do provide a hands-on CPR class where they learn high-quality CPR and how to respond to an emergency with someone that may be under cardiac arrest. And then this year we also exposed them to ultrasound technology. They were able to get familiar with the equipment and learn how to get some readings, and it's really unique in the fact that a lot of the students, they're not exposed to those things before they, get here. So that's what really makes it kind of different from other programs maybe where you're just kind of on the sidelines and not really getting, in-depth learning and training.
Yeah, we know that Alabama consistently ranks among the lowest when it comes to access to healthcare. Do you think that programs like these are working to bridge that gap?
Absolutely. I mean, that is our main goal here. We have a kind of an understanding, and we also put it out that, if you're not from a rural area, you're most likely not going to understand, first of all, the needs of those communities, and you're not going to want to practice in those communities. So we reach down and we say, hey, this is your community. What is it that you would like to give back to them? And we kind of instill in them that, make it better than what, it was when you were there, or what are some opportunities or some things that you didn't have access to that you would like to make a difference in your community. So definitely bridging that gap in terms of the best and the brightest coming and getting exposed to rural Alabama.
So you talk about creating those homegrown providers. So is it like your ultimate hope that these students come back to rural Alabama to serve these communities?
Absolutely. That is exactly what we look for when we're going through our interview process is, tell me about your rural experience and tell me what it is about your rural community that draws you to want to come back. And what is it that you would like the world to know about your community that would draw other people to maybe, provide whatever services that they have and to help those communities be better. So yes, we definitely like to know that it's not just, I want to be a doctor, I want to help people. They want to really make a change and make a difference. And like you said, bridge that gap from the healthcare in rural communities versus in urban areas.
Can you tell me where people can go to learn more about the program and potentially to get involved?
Absolutely. So we have several platforms, being Instagram, Facebook, and of course our main source of information would be our website, which is Rural Programs. And then we're located here in the Northeast Medical Building, where you can stop by. Our staff is always welcoming to students to ask questions. We can provide any information. We have a plethora of literature, our newsletter that goes out quarterly, as well as pamphlets on our different programs.